to this Fireside chat. We're joined today by Eric Mayer, the driving force behind New Day Diagnostics, a company on a mission to transform cancer prevention through innovation. While you've seen the impressive market opportunity in data, this conversation is about something deeper. The vision, the conviction, and the people behind this game-changing solution. We'll explore the challenges, the passion, and what makes this opportunity so timely and so compelling. Thanks, Eric, for joining us today. Let's dive in and hear firsthand about, why New Day Diagnostics is not just a company, but a movement to save lives and create significant value for investors. So to start out, Eric, I'd love to kind of, talk a bit about your personal conviction and vision. You've built New Day Diagnostics to tackle one of the most preventable yet overlooked cancers. What drives your personal conviction to solve this problem?
Easy answer. Family history and my own experiences with, on my mother's side of the family, multiple different cancer types. And I remember as a young kid, probably around 10, 11, 12 years old, when my grandmother had lymphoma and had lung nodules. And the doctor said, did you guys ever notice any symptoms over the years, anything like that? And, she was a smoker and she always had this lingering cough they thought was smoker's cough. And even at that young age as a kid, I remember the doctors basically said, well, that might have been the cancer growing back then all along. Yeah. And that hit me like, holy cow, it was there all the time and nobody knew about it. Right. Nobody found it. Nobody saw it. Right. So that really sparked my journey through, being in life sciences, in healthcare, moving into cancer research at UNC Chapel Hill in my undergrad days, and then working through diagnostics, back in Research Triangle Park, North Carolina, and building New Day from that experience.
Right. Now, how does this, and that's a very, very powerful story, so thank you for sharing that, how does this personal conviction translate into how you lead the company day to day?
Yeah, we obviously have a family first philosophy. And that doesn't just mean, hey, we treat our team members as family, but that means we treat our clients and our customers and our patients as family. We say things like, what would you do if this was your mom? Yeah. Right? Yeah. It might be. Yeah. And in fact, I have a family member that was positive for my blood test as well and had polyps removed. So I know that personally. Yeah. I lead the company with that philosophy. And we believe that you have to kind of have your both mental health and your home family life in good shape so you can be productive at the office as well. Yeah. And it's really about that patient first philosophy, that sort of family centric philosophy.
Yeah, I love that. Look, ultimately it's all about people, right? And you guys are doing something so noble and so powerful that it's great to see that also translates internally to how you approach, your team and hiring and getting the right people involved. I think with every company that's addressing something very powerful, a question that comes up in my mind is why now? Right. Particularly maybe, we're on the dawn of, technology innovation in a way that we've never seen. But just to kind of pose that question to you, right? Like timing is everything in innovation, as you know. Why do you believe that now is the moment to invest in blood-based cancer screening? And what makes New Day uniquely positioned to lead this market?
Great question. So, I've always said that we were liquid biopsy before it was a sexy buzzword in the industry. Yep. We've spent nearly 20 years in primary discovery for colon cancer early detection biomarkers, those signatures which detect that disease early. So we have been on this mission for a long time. Yep. So why right now in 2024? A couple of reasons. Number one is that individuals, not only nationwide, but globally, now understand that they have control over their own health information and their own healthcare journey and their own healthcare data, right? COVID kind of unlocked that.
Yep.
world of diagnostic testing, making it familiar, making it comfortable for people,
Yep.
even so much that they could do it in their own home, the privacy of their own home,
Right.
right? So that never happened in history before now.
Right.
So that was one reason that this is becoming so powerful and so important. And then I would say also, we now know that there are alternatives to colonoscopy, right?
Yep.
So there was a stool test that's been on market for a long time. There are now new blood tests being developed. And those are all novel technologies. This is the time to get involved because this is the future
Yep.
of where cancer detection is going.
Yep.
And we're right on the early stages of this technology.
Yeah, yeah, very, very exciting. Um, Look, with every kind of major idea and ambitious plan, there are always some challenges that need to be overcome.
Sure.
And so, as far as like thinking about the risks, what do you see as being the biggest risks in bringing Coloplex Plus to market, and how are you personally preparing to overcome them?
hmm So, I'd say the biggest risk that we have seen and we've even experienced with our current blood-based cancer detection system is reimbursement, and
Okay.
especially here in the United States,
Yep.
right? Healthcare costs are the top of everyone's mind in America, and even though we have a extremely attractive price point for payers and for individuals that are self-pay,
Yep.
we know that physicians typically aren't going to refer a procedure unless insurance will cover it, right?
Yep.
And so that is one of the risks that we have noticed, one of the big challenges. How are
Yep.
we overcoming that? Several different ways.
Yep.
The first way is developing, and we already have a ton of health economic data that we have been bringing around to the major payers. We
Yep.
have United Healthcare already covering this with a prior authorization, so they're the biggest.
Yep.
And we're working on some of the other private pays, the big six, for evidence-based coverage determination. We have that evidence, right?
Amazing.
So we're working on the coverage.
Yeah.
We're also working on Coloplex Plus. That is the ultimate in risk mitigation.
Yep.
Coloplex Plus combines what is currently on market that
Yep.
we have as approved by the FDA
Yep.
and adds and enhances it so
Right.
that it meets Medicare, Medicaid, and reimbursement CMS thresholds.
Yep.
And that's how we're going to win this market.
Yeah.
Now, there's also a third prong to this, which is outside the United States.
Yep.
And there's fewer barriers and fewer reimbursement issues that we would have to tackle when
Sure.
we go outside the US.
Yeah.
We've designed the product and the company
Yeah.
for distribution,
Sure.
whereas many of the other liquid biopsies are central lab.
Yep.
That means that they can't go international.
Sure. Sure.
So
Sure.
that's how we've mitigated and tried to control that risk as best as possible.
Yeah, yeah, yeah. And I think that's a really important point in that, like this, you're tackling a global issue, right? And so, in that sense, like it's a global opportunity, right? And a very powerful one. Just shifting a bit and talking about like your leadership and the team. Building something at scale, as you know, requires an exceptional team, right? Can you share how you've built the team at New Day and the qualities you look for in the people you bring on board?
Absolutely. Well, I have to give all the credit to my chief scientific officer, Dr. Jason Leggett. He's got 20 years of experience in vitro diagnostics, specifically in colorectal cancer. His PhD is in
Yep.
molecular mechanisms of colorectal cancer.
Yep.
So, right off the bat, we look for experience,
Yep.
obviously.
Yep.
And we have a crack team of individuals with a variety of experiences from other industries as well. So we've
Yep.
brought people in from sales and marketing for, health and wellness, even, real estate experience, for
Yep.
example, or,
Yep.
things like that that may on the surface not sound like it would translate, but actually, as you said at the beginning, business is about people,
Right.
and healthcare is about people,
Right.
right? So we look also for the intangibles.
Yep.
Who has that relationship building,
Yep.
soft skills? Who is
Yep.
trustworthy that is going to bring that high ethics and integrity to my team?
Right.
Because we can always go out and find and recruit experienced people, but you got to have the company culture we're trying to develop as well.
Yep.
You got to believe in that family first philosophy that I'm driving.
Yeah, yeah. Culture is key and overlooked in many companies, I would have to unfortunately say. So that's great that it's on your radar. So lastly, just shifting to sort of the long-term impact, right? Beyond the numbers, What does success look like to you at New Day Diagnostics, and how do you hope this innovation will change the healthcare landscape 5 to 10 years from now?
So for us, success looks like everybody screened that's eligible for screening and
Yep.
screened by a test that they want to take.
Yeah.
If they don't want to take our test, that's okay. There's
Yep.
colonoscopy, there's stool tests, there's new other liquid biopsies. There's a vast opportunity for people to get ahead of cancer, right?
Yep.
So that's the number one metric of success is screening more people and screening those people who right now are avoiding it.
Right.
People that are not going for colonoscopy. They're saying, nah, maybe I'll do it next year. And then a decade goes by, they still haven't done it. Capturing those individuals and getting them screened in case there's something wrong, that's one metric for success. And then secondly, as we continue to grow into the future, I mentioned this very early on in our discussion that, sort of the best practices from COVID, like over-the-counter at-home testing, that's the wave of the future.
Yep.
What I envision is that this technology will be miniaturized, whatever the word you want to use, and get it into the patient's home
Yep.
so that they can screen themselves
Yep.
at their convenience when they
Yeah.
want to do it.
Yeah.
And it's
Yeah.
all about empowering individuals.
Yep. Yep. I'm going to be one of those patients for sure. Fantastic, Eric. Thank you for sharing your vision and leadership insights. It's clear that this is more than just an opportunity. It's a mission to save lives and transform cancer prevention. So I'm very excited for your journey and look forward to seeing where New Day goes. Thank you so much.
Thank you.
Thanks a lot. Bye.
We're excited.